to say that all hands need to be on deck to, and incidentally, you see what we did when we deployed the WOW truck was to test for COVID-19, HIV, and tuberculosis simultaneously, because the Gene Expert machine, the Gene Expert 4, has 4 modules. So you can actually insert 4 cartridges and do 4 different tests at the same time. This probably addresses the issue Francis raised. So purchasing more Gene Expert machines as far as COVID testing is concerned may be a little counterproductive at the moment. And I think until about May next year, SafeEd may not be able to satisfy the demands for SARS-CoV-2 Express test kits. They have all the other test kits, but the demand for now is on the SARS-CoV-2, and the supply is really very low and fairly unsatisfactory. It takes a month it took over a month. It took I think SafeEd from about end of July to 1st September to respond to a simple award letter awarding them contract to supply the 50 Gene Expert machines. So it is not enough to just have additional Gene Expert machines. You have to have the test kits. And getting the test kits for now is a very, very, very serious challenge. I think I leave it here to allow for questions and comments on some issues I raised. Thank you very much. Moyo, you are muted.
Thank you very much, sir. This is very wonderful, and you did not just provide us with the information on the support Kaduna State government gave to this, but also you also gave us a lot of advice on how we need to move forward, and I think it's very remarkable to see.
Let me also add here that having realized, from the results of the tests we got, His Excellency Governor Rufai directed the establishment of at least 1 Gene Expert site in each of the 23 local governments of the state. So in addition to the 12 functional Gene Expert machines we have in the state, well, only 6 of the 12 belong to facilities in the state government. The other 6, 4 belongs to federal facilities and 2 belongs to private facilities. So what the governor did is to purchase of an additional 23 4-module Gene Expert machines so that we have at least 1 Gene Expert site per local government. And then he also directed for the purchase of 2 16-module systems for use in our teaching hospital. The idea is not only to expand Gene Expert, to expand SARS-CoV-2 testing, but also, because one beauty of the Gene Expert machine is that in addition to other tests it does, what we find very interesting is the HIV test and the plasma viral load. So at least you can determine the efficacy of your antiretroviral treatment. So we are taking this testing to local government levels. Some local governments will end up with more than one gene expert machine. Now, in addition to that, the state government is building a 160-bed isolation hospital. I think it will be commissioned very soon, I believe before the end of October. We are also establishing isolation facilities in each of the 23 local government areas of the state. Thank you very much.
Thank you very much, sir. I was about to say that you've done a good job. Now that you even added to the information, I think you've done very, very well. We really appreciate all the support from the Kaduna State government. Our regards to His Excellency, the governor. And I think there's a lot that other states can learn from Kaduna State, and we'll definitely be calling on you and even hopefully have a platform where other states can also learn from your best practices. And it's very remarkable to hear that the 19 northern states have 25 mobile testing machine now, that will be delivered to them soon, and according to you, even more. Some states may even decide to get more. I think with this, we are very much hopeful that we have the capacity not only to defeat COVID-19, but leveraging on this, we will also definitely be able to defeat TB. Thank you so much, because this equipment will further increase the case finding, not only for COVID-19, but for TB, which and this is one of the major challenges we've been having in defeating TB in Nigeria. On that note, I would like to call on our last speaker before we ask the call on our panelists. He's the chair of the House Committee on TB, on HIV, TB, and malaria. He's the chairman of the Nigerian Parliamentary TB Caucus, and he's someone who is very passionate about TB since he came into office about a year ago now. We've been interacting with him, and he has shown a lot of passion for the portfolio that the committee and the issues that is responsible for. It's a great privilege again to welcome Honorable Abubakar Seriki Dairu. You are welcome, sir. Honorable Dairu, you are welcome.
Thank you very much, Maiwa. It gives me a great pleasure to be with you today as the chairman Committee on AIDS, Tuberculosis, Malaria in the House of Representatives of the Ninth Assembly. Actually, as you are aware, pertaining the issue of financing, just before we go on recess, I met with the Honorable, with the Speaker of the Federal Republic of Nigeria in the person of Mr. Femi Bajamiamila, pertaining the issue of tuberculosis. And because we find out that the budget that we have been given to tuberculosis, we felt that it's not sufficient, because we felt without the interventions of the donors, at least we could not be able to reach our target. And we felt that if at the end of the day, the donors are not there, what are we going to do? Therefore, we held meeting with the Speaker, the Honorable Minister for Health, and the Minister of Finance, of which we all agree that the capital of this 2021, at least we are going to do our best to see that additional 50% on the budget of tuberculosis is being implemented, because we felt that we have a lot to do. In March 2020, the 360 members of the House of Representatives, including myself, donated 100% of our 2-month salary to the National Relief Fund account for to fight for the fighting against convicts, pandemics towards the alleviating the hardship that their constituents will face during the national emergency to improve the living conditions of the citizens in various constituencies. And when we did it, even the Senate, they also contributed their 50%. And with the NCDC, we met with the DG and we discussed with him because TB and issue of convicts, they are related. And then we felt that whatever comes, you should be able to also look at the issue of convicts because you should be able to, we felt that we are going to utilize, because even when the issue of convicts came, most of the G-Next machines that were being used are all, they all belongs to tuberculosis from NACA and some certain centers whereby they're testing tuberculosis. Those were where they went and then gathered all these G-Next machines and cartridges to Center for Disease Control. And then we also agree, based on our meeting, that all the 36 states, including FCT, there is the need for them to make sure that they purchase all these G-Next machines, because this is one of the genesis that we are having. And then the Minister of Finance agreed that during the Executive Council, should bring it up with Mr. President, so that all states, all what we are trying to do is that we want all states, apart from the local governments, because this issue of tuberculosis is not just between the state capital or local government. But we felt that the rural areas, that is where our concentration should be, almost 70% in the state. We felt that the primary health care, most of them, they could be able to, in most of the centers, they could be able to have one G-Next machine, so that at least they could be able to have time to test them there. Because you find out that in the situation whereby they don't even have time, somebody from the rural area, and if it is only in the state capital that they are having G-Next machine, he might not be even aware of it. And then we also felt our other meetings with the all commissioner for health, and we thank God, Maiwa, with the stuff TB partnerships that we've been collaborating. Also, we felt that the issue of sensitization should be there, so that at least our health workers, they could be able to go and sensitize people, especially during the market days or whatever, because that is where the problem is. And then even here in the National Assembly, we are trying to amend some certain laws in terms of issue of this tuberculosis, because we are doing our best. And all what I must say, that since the emergence of this pandemic, the healthcare system and service has been drastically affected. There has been a massive decline in the routine notification, as well as a drop in the clinical attendance by the constituents. So those are the type of things that because of the lockdown, people were just there, and then at the end of the day, maybe they might not even have access for them to go and make sure. We find out, even me as the chairman, that the only, just between my 1 year and 4 months, I felt that most of the causes of this tuberculosis is from the bath water that our people normally take, because there's no borehole, and then at the end of the day, they are using well, and then that problems that are from the rural areas, those are the one of the symptoms that our people are having bad water, and at the end of the day, they will be affected with tuberculosis. So donors, and then on our donors, that it's not just the issue of Genex machine that we're trying to focus now. After that, we'll be able to go down the ladder. We'll be able to go to most of the areas to give them good water. That is by donating some certain boreholes. And then even in this budget, with collaboration with the Federal Ministry of Water Resources, we have agreed in every state, at least they are going to allocate almost 100 boreholes to all the states. And then we also want to use the opportunity in our next meeting so that we will emphasize to the governors forum so that they could be able to also provide them with good water, because these are the some of the problems. Because the lockdown measures that was put in place by the government due to the pandemic had also fueled an increase in the poverty level, despite government efforts to provide citizens with palliatives. This had made adherence to strict preventive measures rely difficult, as most people have to struggle for survival. Consequently, this is fueling the spread of the disease among Nigerians, especially at the community level. And also to mention, the federal government of Nigeria, with the help of donors and multisectoral resources mobilization and external partner support, has strengthened some health facilities built. They have built some isolation centers, build the capacity of health workers, and also provide the poorest of citizens with palliative we're having. I could remember some of our testing centers like NACA, at least some funds were being allocated there in order to increase their facilities in their laboratories, because all the testing of the convicts that has been done, mostly it is our facilities of HIV, tuberculosis, and malaria that the Center for Disease Control have been using. And I thank God, presently, they assigned some certain money to leprosy and tuberculosis center in Zaria, whereby even the Kaduna State government, they are aware and they know the impact of the leprosy and tuberculosis center in Zaria, whereby some certain money was being allocated for them in order to expand their laboratories, because around between the northwest axis, that is one of the biggest centers that they are using, in fact, for convicts, and that lab belongs to tuberculosis. So at least we thank God. Without doubt, additional external resources and expertise will also help to strengthen the country's response and development. Our parliaments have not opened up completely, and our sitting is just once in a week. Presently, we are on recess, and by the grace of God, whenever we come back, we are going to start from where we stop. And then presently, even within the National Assembly, there was a committee that was set up in order to look at the issue of the convicts. And then even me as the chairman of tuberculosis, I'm part and parcel of that committee. And sooner or later, by the grace of God, we are bringing up we are bringing up our report, of which, by the grace of God, we are praying that the issue of tuberculosis, with the support of the donors and with what we felt the government are doing in order to increase the budget of tuberculosis by almost 50%, we felt that by the grace of God, the issue of tuberculosis will come to an end. Mr. Mario, I look forward for a very fruitful discussion today. Thank you, and thank you very much.
Thank you very much, Honorable. It's a great privilege for us to have you here, and thank you for all the wonderful work you have been doing. And again, you have the assurance of our continuous support. You are really doing a good job representing us and your constituency. So please, you can always count on our support. I want to thank everyone for still hanging on.
Thank you. Thank you.
The information has been very wonderful. We're just going to take few comments from our able panelists. We have experts from different fields, from different organizations, and I kindly appeal that you limit your comments to just 3 minutes. So I'm going to call on Dr. Ayodele Awe, who is the National Professional Officer for the World Health Organization. He's been working on TB for a long time, he will tell you himself. And this year has been a new challenge for him and WHO particularly. And of course, he has been at the forefront as for leading the WHO efforts to end TB in Nigeria. Dr. Awe also is the acting board chair of Stop TB Partnership Nigeria. So over to you, Dr. Awe.
Thank you. Very blessed by all the presenters, Dr. Lawansin, Malam Kabil Yaya, and Honorable Abubakar, and my friend Francis. You've had very wonderful presentations, and then I think we should make a record of this so that the press can have it. I also want to thank the media for staying with us so far. The purpose of this meeting is that we should give information to the media that will help us to talk to the public about TB and increase sensitization of the community about TB. So I really appreciate you, the press. You have always been with us. Now, we've been given 3 minutes as past, and I want to say that the COVID has really affected the TB program this year. I will say majorly negatively, because we have not made as much progress in finding the cases, as already mentioned by Dr. Lawansin. But what I want to say is that though COVID and TB, they have similarities, as already mentioned by Dr. Lawansin, we need to see how we can benefit from this new respiratory disease that have just entered into Nigeria. And this we are not seeing so much. Kaduna is a very good example, and I think, please, the press, you need to advertise this, what Kaduna has done. If all the states in Nigeria have done this, we'll be able to increase our case finding. Nigeria is still missing 300,000 new cases every year. We are only able to detect 25% of the estimated TB cases. So please, we need what Kaduna has done. Let every LGA have their own diagnostic tools. Presently, we have only 40% coverage of the LGAs with gene experts. So how do we want to make progress when we cannot diagnose? So I give kudos to Honorable, to Malam Kabil Yaya and the state governor, and also KNCB for supporting this. Now, my major point I want to put now is to say, do you know, this is particular for the press, do you know that more people are dying of TB daily than for COVID. I'm sure that people don't know. The problem is for COVID, it is acute. For TB, it is a chronic disease. Each hour, I'm saying hour, there are 18 deaths on TB. 18 persons are dying of TB each day. There is no day, I've looked at the total number of people that have died of COVID. There are only about 1,000. And we thank God for limiting this. But TB, each day, 18 persons are dying. In each hour, 18 persons. And each day, 430 persons are dying. More than even this COVID. But because it is from the community, it is silenced. And each year, 157,000 persons die of TB. So I am expecting that we should do more for TB now. Because globally now, TB is still the top infection killer. And it has shown that it is even killing more people than TB. And I want the press to help us to say, TB is killing more people even than the COVID. And so government should do it. So I am emphasizing, just from what Kaduna have done, we need the same type of presidential task force on TB. The federal government, I mean, the TB program has tried to say for the past 2 years now, trying to stimulate government to say, let's have a presidential task force. Let's bring people together because as already mentioned, the fund for the domestic resources for supporting TB is still very, very low. TB support is majorly funded through Global Fund and through partners. We need government to be as committed as what they are doing in Kaduna State. So please, we need a presidential task force to catch up on what is being done with the COVID. Please, each state EOC, the COVID management in each state should collaborate with the TB program. We have structures on the ground that can be used to even increase detection of more COVID dot centers in the different communities. Now that the TB now, we thank God for the way that the COVID is being controlled now, it is now community. But the community cases are not coming out. And because of the opening of the airlines, there may be new cases that may come in. So for ability for the COVID program to be able to penetrate into the community, let them use our TB 12,000 dot facilities where we have officers. We need to, so that we can use that to detect. Our dot centers see a person coughing. And so if we are able to integrate them, then so the person coughing can also be tested for COVID, and it will also increase our their detection of cases. We also need to increase, because part of the impact that they did not mention is that increased risk of COVID among the TB health workers. And this is already having negative impact on the dedication of our officers. So through this, the integration of the COVID management with the TB program, we need to increase their PPE, the protective, personal protective equipment, so that our officers will have confidence to be able to support the COVID. I think I will just stop here. Thank you.
Thank you so much, Dr. Awe. I know it's always challenging to give you 30 minutes, but at least you did a very good job within the very short time. I'm going to call on the person many people have mentioned today. He has been doing wonderful work on behalf of his organization, and of course, he's also a member of the board and the executive committee of Stop the Partnership Nigeria. Is the country director of KNCV TB Foundation Nigeria. It's a privilege and pleasure to welcome Dr. Bertrand Odume for 2 minutes comment. Thank you, sir. Dr. Dume. Dr. Dume.
Our discussants and other panelists. Yeah. Okay. Hello, Maiwa, can you hear me?
Yes, we can hear you clearly now. Hello. Hello, are you on transit?
Hello.
Hello, we can hear you.
Thank you, the partnership, Maiwa, for hosting this meeting. Oh, I can hear you. Yeah, can you hear me?
Yes, we can hear you. Please go ahead.
Okay. I say I must commend the partnership for hosting the media chat. The discussants and other win and other members of the I'm actually very happy for this. That for us to do all these treatments, and we at KNC expanding access, procuring wild truck, they know, and you heard about their plan for procurement of wild truck across other northern states. This is actually what we want to see happen. We mustn't be all dependent on external donors, and we have the capacity, and that's why we're actually very great that states can actually learn. And we're actually scaling that experience in Kaduna, working with the Imo State government, because the only way to go is an integrated approach to health service delivery. In Imo, what happened bringing on board testing for malaria, testing for hepatitis B, one local government to the other. In Imo, we actually galvanize the effort to the government to learn from the one, and it's really a very
Dr. Dume, we cannot hear you. Unfortunately, we cannot hear you.
Yeah.
Okay. Hello, can you hear me? Okay. I think what we'll do is we'll still give Dr. Dume opportunity to make comments again. But I will invite another panelist.
Maybe the service is poor here. Yeah, I can hear you. Please, you can continue.
Okay. All right. We'll continue. Please, quickly, I will invite the last panelist for today before we go to our Q&A. She's the focal person for TB at the Institute of Human Biology of Nigeria. And more specifically, she's the chief of party for the local organization network 3 project being funded by United States Agency for International Development. Please welcome Dr. Aderonke Agbaje. You are welcome, ma.
Thank you very much, Mayowa. Good afternoon, everybody. I'd like to acknowledge the presence of our indefatigable honorable chair, Honorable Seriki, for all his efforts. I'd like to acknowledge the national coordinator, the gentleman of the press, all of the protocols duly observed. I'd like to thank the speakers. They've done a very great job, and of course, Dr. Aware and Dr. Dume that spoke earlier. I'd like to speak from the context that COVID is here to stay, and I'd just like us to have a few reflections on the what other speakers have said, and to emphasize a few things as well. So the speakers spoke extensively, especially Frances and the national coordinator, Dr. Lawansi, about what has happened with resource reallocation and realignment with regards to COVID-19. And of course, we all know the resources we're talking about: man, money, materials, basically, and TB man resource with funds, with materials being reallocated and realigned to attend to COVID issues. We've had DRTB admission centers being converted to isolation centers. Therefore, the DRTB patients didn't have access to these resources. We've had talked extensively about the genetics machines, the HIV lab, etc., that have been redeployed to support the COVID response. What I would just like to focus on with regards to resources is the human resources. We've heard a lot about what government is doing, getting more funds, which TB can leverage on, building more laboratories, getting more gene expert machines. But we also have to talk about the human resources. And I think it's Dr. Awe that talked about this earlier, providing protective equipment, personal protective equipment for the human resources. Beyond that, we also have to look at the strain on the human resources for health in responding to COVID. And since we have our leaders represented here, that's a message that I'd like them to take back, and would also like the press to emphasize and to broadcast for us that there's a need to reassess the human resources for health, both at the federal level and at the state level, so that we are sure that diseases like tuberculosis and other health issues are not being placed on the back burner in our response to COVID. So that is one message I'd like the press, the gentlemen of the press, to take back. Another thing I'd like us to reflect on is stigma. And I know that the other speakers, especially the national coordinator, had also talked about this. There has, over time, people have started denying the symptoms of TB, which are very closely related to COVID. So the gentlemen of what COVID is all about, what the symptoms are, the signs, etc., would like them to take this message back to say that it could also be TB rather than COVID. And these services are available for people to access. So people should not be afraid of admitting to these symptoms, because there are other diseases, and TB is one of them that could be. And I'd like us to also reflect on that. And another thing, and I know Dr. Awe dwelled on this a lot, is the need to strengthen the operationalization of the COVID TB integration. So Dr. Lawansin had spoke a lot about the great work done at the policy level, pushing out the policies, the document, reviewing and refining. But what does this mean at the lower level, at the operational level? What do the lab scientists that are operating the gene expert machine, what do they understand by this? What the infectious diseases hospitals that have the isolation center, what does this mean to them? Do they think, oh, now we're testing for COVID, we don't have time for TB, or we can't admit TB patients because, we need to take care of COVID patients? Dr. Awe already talked about the mortality and the seriousness of TB. So we want that message to go out as well, that TB should not suffer because of COVID, because a lot of more people have TB than those that have COVID. This is not to de-emphasize the importance of COVID, but just to further emphasize the importance of tuberculosis. A fourth reflection, so we need to strengthen that operationalization. Fourth thing I'd like us to reflect on is with regards to governance. And, Frances spoke about this a lot. I'd really like to appreciate and join my the other panelists and speakers to appreciate the efforts of the Kaduna government, what they've done. They've done a lot. We can see the government taking leadership and some other states as well, buying SARS-CoV cartridges, making plans to get more mobile trucks, gene expert machines, etc., etc. But would also like them to do the same for TB. Would like our government at the federal and state levels to also put TB on the front burner, just the way Dr. Aware with regards to COVID shows that it is possible if resources, if effort, if focus is brought to a particular thing. And this also happened with Ebola. It is possible to address this issue and to eliminate TB. It is possible. So we'd like the same effort. Malam also spoke extensively about COVID. Would all like that to happen for TB as well. And other speakers have spoken about the areas of integration. And also, Kaduna State government can discuss with in the isolation centers. They should also help us think about DRT, admission services that can be co-located in these isolation centers. So the DRTB patients in Kaduna State can have more easy access to the treatments that they require. That's all from me. I'd like to thank you.
Thank you, Dr. Agbaje, for your comments. And also we want to commend the work that IHVN is doing. And one of the things I forgot to add is IHVN is also one of the principal recipients for the Global Fund grant in Nigeria, and they are one of the organizations that has been performing remarkably well. So thank you so much. On this note, we want to open it up for question. Though we have a few minutes, but we can still take a lot of questions. If we can make the questions very brief. And I'm going to start with one hand that's been up for a while. That is Florence. Then immediately after Florence, we take Kingsley, and then we take Prudence, and then Gloria in that order. We take this first round of questions in this first round, and then before we take maybe another four or five questions for second round. Florence, just make it brief, please. Thank you very much. Kindly unmute yourself, Florence, please. You are permitted to talk now. Just unmute yourself, please.
My question has been addressed by the Kaduna State representative. I wanted to ask how far has the KNCV van, that was the wild truck van that was launched 2 months ago in Kaduna State, but he addressed it at the cost of his speech. Thank you.
Thank you very much. I appreciate that. So Kingsley, look, Kingsley, over to you.
Yeah, I'm with you. Thank you very much. I want to thank all the contributors to this program. It was quite educative and interesting. I want to direct a question to Dr. Francis, who talked about financing and the role of the private sector in contributing their own quota in resolving the issue of TB and COVID-19 infection is actually very important. So, but she didn't clarify, she didn't speak extensively on what roles specifically the private sector can do to improve testing and care for patients with such conditions. And bearing in mind that any private sector driven economic investment also has focus on profit generation. So I want her to talk more on that. Thank you very much.
Kingsley, before you go, can you quickly introduce yourself, please?
Okay, I'm Dr. Kingsley. I'm working in ABU Teaching Hospital Zaria.
Okay, thank you very much.
Thank you.
Florence, if you don't mind, can you also quickly introduce yourself? If you are still there, Florence. Okay, let's go to Prudence. Prudence,
I'm here.
Yourself and then you can talk, please.
Okay, my name is Prudence. I would like to find out, during the last World Tuberculosis Day briefing, Honorable Dayu promised that he was going to give gene experts to Nigerians. I would like to know if the gene expert machines have been provided.
Okay, I will get him back on the line. I think we have lost him. I will get him back on the line to answer that question. That is a very good question and a reminder. Thank you very much. Gloria, please.
Hello.
Hello, Gloria. We can hear you.
My question is for Dr. Frances Ilika. She was saying something about domestic funding, and every time we're talking about this domestic funding for tuberculosis. And I know that the government is trying to merge some of these things together, but she said there's so much attention on COVID-19. I want to know, how has COVID-19 funding affected the funding for tuberculosis? And what is the private sector doing to leverage on this?
Okay. Okay, thank you, Dr. Francis. And she will answer appropriately. I'm giving the floor now to Bumi Tejumola, but please, all our speakers and panelists kindly note the questions because we're going to call up you very soon. Bumi Tejumola, please.
Yes, hello, can you hear me?
Hello, yes, ma, we can hear you.
Yes, I appreciate all the speakers. The presentation are so good and very fitted at this time on TB. My own question actually is on funding for CBOs that are working on TB, especially on active case finding. We have been working, being supported by Global Fund for years, but in Lagos, presently, the state had become the recipient. Despite the fact that we are providing workers for them, there are issues we are facing. We couldn't get in fact, not even 1/3 of the number of active cases since COVID-19. More or less, people are very scared that you are taking them to isolation centers, that they will be isolated, and they prefer not to even allow you to get samples for test or to even go to their center. Unfortunately, we have recorded a lot of deaths. Seeing this, we are not happy about it. We ourselves, as Francis had mentioned.
I hear your voice with my mic being on mute. No, because.
Can you hear me? Hello? Can you hear me? Hello?
Well, I can hear you. I can hear you. I suppose others can hear you as well.
So, we as well want TB to end as polio had ended. And we are feeling so much concerned seeing this coming up. of low active case finding when we know we are actually sure that some have been drug resistant and they needed to be attended to, but they refuse to come out. We need to do community outreaches and bring them out. My point. Thank you. Over.
Your mic is muted.
Oh, okay. So sorry about that. Once again, we're just going to take responses from speakers and panelists, starting from Malam Kabri Yaya. Just kindly address the questions briefly. Thank you very much.
I'm not sure there was any question for me, apart from, Florence that probably said that I've answered her question. But suffice it to say that, you see, we were made to believe that we had 12 gene expert sites ready in the state. So we went ahead and ordered 10,000 test kits, only for us to realize that out of the 12, only 6 or 7 belong to the state government. And out of this 6 or 7, only 1 has a level 2 biosafety cabinet. So unknown to Dr. Odume and the WOW guys, their truck came in as a huge blessing to us. So we put mechanisms in motion to acquire level 2 biosafety cabinets. And you know there are very serious challenges now with supplies, with freight. What you would normally pay a token amount for freight, you now end up paying about 5-10 times. So at the time the World Truck was, the governor commissioned the World Truck, we only had 1 functional site. So it was the World Truck more than any other facility we have locally that helped us to determine the, to map out the demography and distribution of the disease, because the young men and women on the World Truck did a fantastic job covering a good number of local governments in the state. At least we were able to establish a higher COVID-19 prevalence in urban areas and densely populated parts of the state than in rural areas. This is not to say that there isn't COVID incidents in the rural areas. And actually some fringe local governments bordering other states where there wasn't too much control or movement, were among the local government areas we suspected to have very high incidence. And 1 or 2 of those local governments happen to actually have the least COVID incidence in the state. That is, so the WOW Truck, and actually it is the WOW Truck that the presence of the wild track in Kaduna that gingered the northern governors, because there was already a decision to purchase another track from some other sources. But we found the wild track far, far, far cheaper and more versatile in terms of having a digital X-ray machine with with COVID and TB software, as well as a small space for laboratory. So, the wild track is solar powered. So it turned out to be a better configuration than what was presented to the northern governors before. So when the wild track, when His Excellency Governor Rufai presented the wild track option to his colleagues, everybody jumped at it. States like Kogi that were initially food dragging, Governor Hayabello was so impressed that he made a commitment of having 3 wild tracks for Kogi State. Some states are having more than 3, some 1, some. So that's why we are. The point is, the only reason why we are seeing what appears to be low COVID figures, is because we are not testing. That is the truth. And the test centers are so widespread that you cannot vouch for the integrity of your sample, bearing in mind that you need to keep the sample at room temperature for 8 hours. Now, room temperature in Europe is definitely not room temperature in Nigeria, because I remember in my student days, room temperature was about 20 degrees. Now, even ambient temperatures here, the coolest ambient temperature is about 21, 22 degrees. So if you bear the Arrhenius theory of thermodynamics in mind, that for every 1 degree rise in temperature, there's a 10-fold increase in reaction rate. Only God knows what will happen to a sample that is transported, let's say from Konshisha local government in Benue State to the NCDC laboratories in Abuja, or a sample transported from Bonza or Malampatori in Sokoto and Borno respectively, or from Odukpani in Cross River State to a testing center that is far away. So yes, there is need to have these testing facilities, at least in each local government. And you know what? For some of our local governments, I know a few local governments in Nigeria, I think about 6 or 7, that are bigger in size than some states in the country. So for some local governments, it is not enough to have 1 gene expert machine. And for densely populated areas, I know Lagos, for instance, has one of the, and the states of the Southeast have the highest population density in the country. So there's also need to look at the population distribution in states to determine the number of test sites you need to have. And as much as possible, there need to be devolution from the national government to the subnational governments, because what happens in Malampatori is, someone in Maiduguri is more likely to know what happens in Malampatori than someone in Abuja. And I think that is one reason why the framers of our constitution makes health, puts health on the concurrent legislative list, so that states, local governments can participate in the provision of health services. Let me, at this point, thank the national TV program for allowing us to use the gene expert machines. But I assure you, as far as we are concerned in Kaduna, the young men on the world track conducted simultaneous tests for COVID-19, for HIV, and for tuberculosis. And we came up with many results. Many of the patients that we suspected were COVID-19 positive actually turned out positive for pulmonary tuberculosis. So we thank the National TB program for allowing us to use the facilities. And I would like to call upon, if we have any Global Fund representative here, I would like to call upon Global Fund, UNICEF, World Health Organization, to be a little more responsive. Because like I said, I contacted a Global Fund rep as far back as July. He said he would get back to me, and he never did. And you know what? Like one of the panelists said, one of the speakers said, this COVID is here with us, and it's likely to be around for a very long time to come. Let us not deceive ourselves. We are probably only assisted by geography and by probably our previous exposure to malaria. Because one interesting thing about COVID is that if you look at the COVID incidence, the global COVID incidence map, superimpose it with the map of malaria endemic areas of the world, you find that those parts of the world that eradicated malaria are the worst affected by COVID-19. While Sub-Saharan Africa, India, South America, with the exception of Brazil, where we probably had lots and lots of chloroquine, nivaquine. Maiwa, I'm not sure you had nivaquine in your life. You are too young, but those of us have had exposure to all sorts of queens. So that probably gave us some herd immunity, and actually added to the fact that so far there are different strains of COVID, and the less virulent strain has probably decided to come to Africa. Thank you very much.
Thank you very much, sir. We are definitely need to have you back again, Malam Yaya, just to let you know. But we are very constrained with time today, so I think at another time we will give you more opportunity to be able to talk. For the sake of our time, I'm going to ask Frances to respond to a few questions directed at her, and to also give us parting words. And after that, Dr. Adebola Lawansin will do the same. Professor Umar, who has been kindly and gently waiting, will do wrap up for us. We have really spent, it's been an exciting time on this platform. There's no dull moment, but I would wish we can continue for a long time, but no, we can't. So over to you, Frances, then Dr. Lawansin and Professor Umar, and we'll call it today. Thank you.
All right, thank you very much, Mayo. I'd like to keep this very short. So very great, stimulating conversations that have been going on. I'll just go very quickly to the question on private sector. So private sector plays a big role. I think COVID-19 has actually shown us that if private sector were interested, they can actually contribute a lot to some of the key health problems that we have. So talking about how we can engage the private sector. The private sector at the moment is already playing some roles. An example will be the ABAMI partners that are already contributing towards TB control, through building laboratories and treatment centers and things like that. So this can be expanded. So we need to identify more private sector partners to play a bigger role. They could do this through corporate social responsibilities, or even identify philanthropists, make them TB champions and give them awards and recognitions, high net individuals and people who can actually play a role. The Rotary Club, they've actually been there. I've attended a conference where the Rotary Club in Uganda is actually spending a lot on HIV control, so we need to identify these people, including other companies like the Chevrons and the Coca-Colas and the Dangotes. So these are people that could actually contribute a lot to TB control. They could actually do this through providing funding, to the control programs, or they could actually go out on their own and invest. So they can purchase gene expert machines, they can optimize the already existing sites so that they can meet standards which will contribute to TB control. They can actually build more laboratories. They can actually build treatment centers. Some people have been talking about treatment centers for multi-drug resistant TB patients. They could actually do that. Now, one thing with that we know about the private sector is like the person that asked the question mentioned, they are for profits. So there are different things that have been tried, looking for incentives that would make them want to do this even more. Incentives can be cash, financial or non-financial. So some people, there are a lot of debates. People are talking about tax, rebates and, things like that. And then, of course, the easier ones will be the awards, the recognitions, being known as a TB champion, being invited to government events and given a special recognition, which indirectly has a financial incentive, because if you're known to be a big player in that particular field, it could actually make people, patronize you more, and that would also give you more business dividends and all of that. So there's a lot that they can do, and we need to put the evidence together and begin to have this advocacy. There could be fundraising campaigns, there could be TB campaigns. The media, first of all, the media can actually help us to package this information and share with the people, this private sector, corporate sector partners that can actually spend more on TB and HIV and these priority disease interventions. On the other hand, the media can also take up the bulk of their money with regards to airing TB messages to the populations and all of that, so that the National TB Control would actually have some savings with regards to the amount of money they would have spent on community mobilization and all of that. And then some of that could actually go into, other spending that needs to happen. So another segment of the private sector will be people who work in healthcare. So laboratories, petty, what do they call them? Patent medicine dealers, that's the chemists and all of that. Private healthcare providers, a lot of them have a role to play as well by providing TB services to patients, making their centers available for TB patients to access care and all of that. So the private sector is actually a huge untapped area that we can actually go out there and try to begin to tap. Some private sector people may decide to sponsor a CBO or a CSO that is involved in community mobilization for TB. So the list is endless, and we can only explore and look for more opportunities and innovations. Another question spoke about how has COVID-19 spending affected TB funding. What we know at the moment is that in a lot of states, traditional funding for TB, especially capital expenditures, are being halted. When people write memos and all of that, they're not being released because it doesn't have to do with COVID. Of course, it's understandable that everybody wants, to address COVID to make sure that we can all go back to our usual lives and all of that. But at the end of the day, TB suffers, and we're running into this secondary crisis that I spoke about earlier and all of that. So the media has a role to play. We all have a role to play to make policy makers and decision makers realize that abandoning funding of every other thing and just focusing on COVID-19 spending alone is not good for us, and that it will hurt us in the long run, and there will be very severe consequences, like Dr. Awe and other people have mentioned. More people are dying from TB, and we don't want to get to the point of this epidemic control, TB epidemics, that it will become so bad and then it becomes like a big problem, just like COVID is causing, and it's disrupting things and affecting productivity and affecting the way that we live our life. So we want to make sure that we actually continue to fund these essential services to make sure that we don't get there. So at the moment, what we know, like I mentioned earlier, is that these capital releases are not happening in a lot of states for TB, for HIV, and for some other disease area, because the government prefers to fund COVID, except you link it to COVID-19 spending. By the end of the year, when we have the Accountant General's report, then we'll know for certain, to what extent TB allocations this year were affected by COVID. But we don't have to wait till the end of the year, because we can already see that these funds are not getting released. I hope that answers that question. So talking about some key takeaway messages, we've had some very good conversations with regards to what we need to do. And I think some of the things that have come out very clearly is that we must continue to fund TB through our traditional government budgets. So let the media, and everybody involved take that message back to COVID-19 does not mean that all the funding should be reallocated to COVID or displaced to COVID. We need to continue to fund TB to make sure that we don't run into problems and we don't run into even a bigger problem with regards to TB control. We need a multi-sectoral collaboration. We need everybody, we need all hands on board, TB programmers, CSOs, the media, everybody needs to come together. We need to put the information we have together and package it well and advocate to the relevant people to say that we need to increase the way that we fund TB. We need to make sure that TB services are not disrupted, and we need to make sure that we put mechanisms in place. So it has to be intentional. We need to intentionally make sure that these things do not continue to happen. Perhaps one of the important things I want everybody to go away with is that the Basic Healthcare Provision Fund and the state health insurance schemes are perhaps low-hanging fruits to make sure that TB gets stable, predictable, and sustainable financing. So we must go out there and begin to make these advocacies to say, we need to implement the BHCPF. The National Council on Health has given the approval. Implementation needs to start immediately. And we need to make sure that TB is properly captured there. The same with the state health insurance schemes. All the states are starting off their schemes now. We need to make sure that TB is properly captured there. We need to make sure that the spending that we're doing is efficient. We have accountability mechanisms in place. And then, of course, we should stimulate private sector investment. So thank you very much.
Thank you very much, Frances, again. We need a special session with you also, just focusing on TB financing in Nigeria, and just talking about that alone. And one of the things we also need is TB scorecard that looks at the TB financing in each state, maybe for the past 3 years. And we can discuss that and maybe also use that as an advocacy focus for Stop TB Partnership Nigeria. But we really appreciate your presence, and thank you very much. Last comment from Dr. Adebola Lawansin, the National Coordinator. She has been with us this while. She has listened to everything that's been said, and over to you, Ma, if there's any question targeted or directed at you, and then also for your last comment. Thank you very much.
So thank you very much, Mr. Mayowa. Thank you everyone for your for the contribution. I don't think there was any question that was targeted to me, but I just want to use the opportunity to appreciate all the speakers. I want to appreciate the honorables, as well as the Malam Kabir from
Kaduna State. I really appreciate all the support we are having from Kaduna State. And one thing that is also very important is that we are also focusing on Kaduna State with support from the Global Fund to strengthen the system to be able to be responsive to TB response in that state. The last words that I have is to say thank you to everyone. Thank you to our panelists for the great the great beautiful words that we've said and the great words they have said. But one thing, as Dr. Agbaje said, is that I know a lot of awareness, health education, information around the COVID-19 is going on in the media. One thing I also want to plead is that I want the media to support us in letting the information on TB control and TB response. Whilst we look at the resources to support for TB service delivery, which is the supply side, it's also important that we look at the demand side, and the demand side is heavily resting on the media to help us take our voice at the national into the community, into Nigerians at large, to let them know that TB is a disease that is curable, that is treatable, and it is important that people who are coughing for 2 weeks or more assess all the supplies that have been provided, both at the public healthcare facility as well as the private healthcare facility, because we are also working very heavily with the private, with all the support that we are getting from our donors and also from some of our private organizations in country. I want to also say a big thank you to Stop the Partnership for their great support, particularly to advocate to the significant orders so that we can continue to harvest resources within the country from state government, from lower, state government to support TB response in Nigeria. Thank you, everyone. Thank you for your time.
Thank you very much, Ma. We really appreciate you and your leadership, your charisma, and your passion to NTP in Nigeria. Now I would like to hand over to Professor Lawal Umar. Over to you, sir, for the summary and closing remarks. Just let me mention that Professor Umar is the chairman for the Childhood TB Committee of the National TB and Leprosy Control Program. He's a member of the board of the Stop TB Partnership Nigeria, and of course, the professor of pediatrics at Ahmadu Bello University, Zaria. Over to you, sir. Thank you.
Thank you very much, Mayowa. Good afternoon, everyone. Am I being heard?
Yes, we can hear you loud and clear.
Thank you very much once more. I feel honored to be invited to this forum to summarize, as you said, and conclude. But let me admit that there was so much that was discussed today over the past 2.5 hours or so, and it is going to be very difficult for me to summarize all that has been said in just some 5 minutes that you want me to. But I think it suffices to say that we have heard from the various perspectives of TB funding, governance and leadership, as well as service delivery. So let me just quickly go through what especially the panelists, the presenters have talked about. We had the opening by the Stop TB, acting Stop TB chairman, Dr. Ayodele Awe of the WHO, who opened his speech by emphasizing the gravity of the TB problem in Nigeria by way of bringing out the TB reporting gap with the abysmal reporting of only about 27% of the cases that were estimated for Nigeria, and that is so abysmal. So he posed that as a question to all of us and partners concerned as stakeholders as to how we can continue TB services in the midst of the COVID-19 pandemic, and how can we leverage on the COVID-19 pandemic response to address TB services and maintain them without necessarily suffering, or even with the using the advantage to advance TB programming in Nigeria. Next, after him that spoke was the national coordinator of the National TB and Leprosy Control Program, Dr. Adebola Lawanson. She gave a very good overview of the TB situation and COVID-19 in the country. She started by comparing and contrasting TB disease and COVID-19 disease, showing so many areas of similarity and some areas of differences. And she went ahead to spell out the challenges so far that are being observed with the TB program. Hello, am I being heard? Hello?
Yes,
Prof,
we are hearing you. We can hear you loud and clear.
The LC went ahead to enumerate the challenges, so to say, a lot to do with personal challenges for patients accessing services, and what the lockdown has brought in by way of denial of access, disruption of services, and going down to the level of the socioeconomic impact on patients and their families, and then what these are likely to do on the increasing cost of, or rather the increase in the catastrophic costs for TB brought about by confinement and so on and so forth. She also went ahead to mention the positive impacts of COVID-19 that appear to be opportunities that are already being exploited to improve TB services. He mentioned that the communication materials that are being developed for COVID-19 alongside TB, it is helping to increase awareness in the communities. And that's a very good positive impact. And then also the increase in political awareness for TB. You know, when issues that cut across TB and COVID-19 come along, and there is need to integrate in one way or the other TB activity or TB services with COVID-19. For many political leaders, that is when they are aware that certain services share similarities and they could be aligned together for better outcome. And then the advantage of increased IPC materials and PPEs at facilities where they don't used to exist, where there has been scarcity of PPEs, with what the NCD is doing now. These PPEs serve dual purpose, not just a dual purpose, but many purposes for any other infectious disease that could be around. So initially our fear was that there could be diversion of these supplies for use in COVID-19 isolation centers and quarantine centers. But it is now clear that the increasing commitment of government to continue to supply these items without any breakage is providing opportunity for continuity, not just for COVID-19 needs, but also for TB services. And then she also mentioned about how the processes of optimization of gene expert laboratories has come as an advantage, because previously there were lots of gene expert machines in the country that were not really functional. Some were operating at the suboptimal level, but because of efforts now to integrate and run COVID-19 testing on gene expert platforms, many places where such optimization was needed had this advantage, and now they're able to utilize that. And then so many other advantages. She mentioned what has been happening at the state levels, where even SOPs have been developed that improve outreaches for house-to-house contact tracing, and how the national program has also worked vigorously to maintain supplies, of TB items
without any interruption. And then she told us how the national program also integrated TB and COVID-19 case finding using algorithms, making it simpler for healthcare workers to be able to identify these conditions at the same time. And then what other activities that were also beneficial included the getting the national TB control staff and even at the state levels, TB control officers to be co-opted into the NCDC response at the national and EOC levels. And this is carrying the interest of TB programming further ahead. So that is the opening by the national coordinator. After her came the country director of Health Policy Plus, Dr. Francis, who a lot more talked about funding and financing, as well as quality, and how to improve financing for TB. She reminded us about the huge funding gap of nearly 60% pre-COVID, and how 32% of what is being funded is donor dependent, is largely from donors. Now, she also reminded us about the 71% catastrophic cost for TB patients and their families in Nigeria pre-COVID. Now, what is not clear now at this moment is to what extent have these gaps been impacted upon by the arrival of COVID. We don't know yet. Perhaps there is need for studies, not just for funding gaps and increase in catastrophic costs, but also for figures actually of patients that had reduced access or poorer access during the COVID-19 outbreak. I think it will be a nice thing to study for us researchers. We are looking at how, the attendance, for instance, dot services to clinics and became affected over this period of COVID-19. It will be a nice thing also to look at how funding suffered, what accounted for the gap. And it will also be nice to find out what proportion of funding that was meant for TB originally now went to COVID-19. And how can we recoup that and restore it for the betterment of the TB program in some future to come. She also suggested what to do in terms of political commitment, political leadership, that is, for giving priority to TB. And then she also talked about resource mobilization at all levels of government to increase financing for TB and to also stimulate private sector involvement to health spending, not just TB, but the entire health spending. She talked about the need to get an increase in external funding and integrating TB and COVID-19 services with sound policies, that is backing them up with sound policies. She also advocated for provision of more gene expert machines and civil society engagement and involvement in to this effect. She emphasized a lot on governance and spoke about the need for SOPs to address the TB and HIV, COVID-19 testing and increase the effort at optimizing the gene expert sites and called for oversight and accountability by the legislature, civil society, and other sectors of the society. She also suggested multi-sectoral response, which is already taking place, at least at the national level, and even at the state level. EOCs at their states are including many sectors in their responses. She concluded, if I recall very well, by saying that Nigeria was celebrating COVID-19 eradication. If I recall very well, that's what she said. I'm sure she meant to say polio eradication, not COVID-19. But I'm sure that was a slip of tongue. Then came the Kaduna State senior special assistant to His Excellency, the Governor of the Kaduna State, Alhaji Kabiru, Malam Kabiru Haya, who gave this state perspective. And being from Kaduna State and being part of the state EOC, I can say with all confidence that what Malam Kabir has said is exactly showcasing the leadership role of Kaduna State in taking up the challenge of COVID-19. As you can see, he told us how the state started forecasting even before the disease became announced as a pandemic. And then thereafter, many steps were taken to address the issue of testing by sourcing for gene expert cartridges and making the state the first in Africa, not just Nigeria, to have acquired a lot of testing platforms using the gene expert cartridges. And he told us about how challenging it became later after securing these 10,000 cartridges, how difficult it was to get over the issue of, sustainable supplies of these cartridges from the source, that is Cepheid, and how, Cepheid itself is facing challenges with overwhelming demands from all over the world, challenges that are difficult to meet. And so the lesson from Malam Kabiru is that perhaps our agitation for gene expert machines should be tempered with realization that even if we acquire gene expert machines now, or we put order for them, we may not get them readily. So maybe the best strategy is to try to optimize the use of those gene expert machines that we already have. How can we maintain their services for both TB and then also for COVID-19 testing without TB services suffering at all? So, and I think the lesson from the experience in Kaduna State should serve as what our journalists here, our media people can sell out for other states to learn. The Kaduna State has led the way, not just for the 19 states of the Federation, but the whole nation as to how to go about the process of addressing testing challenges for COVID-19 alongside TB testing. Finally, we had the input of the chair of the House Committee on TB, HIV, and Malaria, the Honorable Abubakar Sarki, who is also the chair of the Parliamentary Caucus for TB. We heard from him what efforts his committee has been doing to secure more funding for TB. And we are glad to hear from him that in the capital budget for 2021, it has been promised that TB budgeting will be increased by 50%. We're very glad to hear about that. And we hope that this gesture should also be extended to also address TB, malaria and HIV, because they also are quite important to us. And the same effect of COVID-19 is likely to affect these services, or services for HIV and malaria, as they are doing for TB. So we'll be glad to have a similar advocacy and increase in funding for these diseases. We are also informed, he reminded us rather, of the personal commitment of the members of the House to donate entirely 100% of at least 2 months' salaries for the COVID-19 response, which is quite commendable, and that paved the way for what the upper house also had to do. We are very grateful for these moves. He also mentioned what the committee is doing to further advocate to the NCDC to carry along TB with the COVID-19 response, wherever the need should arise for integration and improved funding and support for TB services. And be rounded up with the advocacy they have been making to the states to consider procurement and more gene expert machines to allow more testing for TB as well as now currently COVID-19. So in a nutshell, I think this is perhaps a fair summary of what the presenters have said. I can't go on to talk about what the other panelists have said, especially as the last of the panelists, Dr. Abaji, appears to have summarized what the speakers and some of the panelists have said. So, Maiwa, if you will permit me, I want to close this meeting, if you will allow me, by extending our appreciation from Stop TB Partnership. Now I'm talking in my capacity as a member of the Stop TB Partnership, and then also perhaps as chairman of the National Childhood Steering Committee on TB. We want to appreciate honorables from the National, from the House Committee on Malaria, AIDS, and TB for sparing the time to be with us for this period. We say a very big thank you, and we appreciate your effort at the Assembly, working to improve the cost of TB in the country. I also want to thank the Senior Special Assistant on Health Matters to the Kaduna State Executive Governor, Malam Kabir Yahaya, for enlightening us about what bold steps Kaduna State has been making to lead the way in the response for COVID-19, not forgetting TB by the side. Thank you very much, sir, for sparing your time to come along and present what Kaduna State has been doing. That is what you presented, sir, is evidence-based, and it's a good practice that should be emulated everywhere in Nigeria. I want to also thank our amiable national coordinator, the National TB and Leprosy Control Program, who has been very passionate, as we know, about TB issues, and her effort is very well appreciated. Thank you, Ma. Thank you for supporting this activity, and thank you for being here with us. I want to also thank Francis Ilika, the country director of Health Policy Plus. Your organization is doing very well, and we implore on you to do more. I had wanted to hear actually what Health Policy Plus has put aside as a proportional increase in their funding for 2020. Have you realized that COVID-19 may have affected some of the services, and therefore the funding they kept aside may need some booster? Thank you very much anyhow, we are glad. And then I also want to quickly acknowledge, of course, amongst our panelists, first of all, the Stop TB Acting Chairman, Dr. Ayodele Awe, for being here throughout. Of course, this is his own activity, this is his own event, and leading the way for us. Dr. Temito Tayo was not here, but Dr. Bertrand Odume was here, and we thank Dr. Odume very well for his contribution. I'm not sure whether I had Dr. Queen Oguji, whether she was around, but I'm sure I had Dr. Abaji. Dr. Abaji, thank you very much. I also want to thank all partner and stakeholder organizations and their members that were on this forum listening somewhere. I want to also thank all our media, invited media practitioners, their organizations, for making this event a very good success. Thank you all very much. And then finally, I want to say kudos and thank you and congratulations to our one and only executive secretary of the Stop TB Partnership, Mr. Maiwa Joel, for putting all these things together. Thank you, Maiwa. Thank you for being there for us. Good evening, everyone.
Thank you very much, Prof. you can be rest assured that if you ask Prof to summarize, he's really, really going to summarize. So on that note, we want to say a very big thank you to everyone. Please, our panelists and speakers, we quickly want to take a group photograph if you don't mind. So if you can on your video briefly, we are waiting for Dr. Aware and Dr. Lawansi. And Dr. Aware, we are waiting for you. Dr. Lawansi, you need to adjust a little.
Except if you want to take my picture with my singlet on. So I don't think I will.
Okay, all right, sir. We just go ahead with what we have. Okay, Frances, we're waiting for you. Professor Omar, something is blocking your face there. I know you're in the car, but you need to remove that thing that is blocking your face or move to better. Okay.
How about now?
Okay, it's better. It's better now. Okay, all right. So 1, 2, go. Oh, okay, Dr. Aware. Hey, Dr. Aware is back online. So with t-shirts, not singlets. So I'll take it now again. Thank you very much. It's been wonderful. Please, one of the things our media correspondents are asking for are your notes. Please just send me your notes, even no matter how raw it is. It will be very useful for us. And some of them may be contacting you to seek for additional information or clarification. Thank you very much. And you can be rest assured that next time we'll do better. And we'll talk to Prof. All right. Thank you, everyone. Enjoy the rest of your day. Bye.
Thank you, everybody.
Thank you.
Thank you, Mayo.
Thanks.
Thank you, Auntie Ronke.